Chair lays out House Bill 3540. Chair lays out a complete committee substitute. Chair recognizes Representative Harless to explain the bill.
Thank you, Mr. Chairman and members. The committee sub for House Bill 3540. Members, before you today is a committee substitute that is agreed to by the Pediatric Society, All Pharmacy, the Texas Medical Association, and after many sessions of this issue coming before this body, a compromise has been reached. I'd like to first say that this bill is just about access for families that choose to vaccinate their children. Following the expiration of the Federal Public Readiness and Emergency Preparedness Act, Texas pharmacists cannot, without a physician's protocol or standing orders, administer vaccines to patients under the age of 14, or administer flu vaccines to patients under the age of 7. The ability to obtain immunization and vaccinations is critical for families that choose to get them, especially for rural Texans who experience an increasing lack of constant and ample access to physicians. The committee sub for House Bill 3540 would expand pharmacists' vaccination and immunization authority to allow them to service patients age 5 and up with all approved and authorized vaccines, and they could service patients 3 and up with flu and COVID. This bill would also require pharmacists to provide notice of vaccination to a patient's physician within 3 business days with a recording of the vaccination in the state-maintained immunization registry serving as notice. This bill would also require pharmacists to inform patients and adult caregivers of the importance of an annual well child visit with a pediatrician or primary care provider to help ensure that we're still promoting doctor visits and letting patients know that pharmacy visits don't take the place of an annual checkup. Finally, this bill would allow pharmacy technicians who possess the necessary education and certification to administer the vaccines, but it would not allow a pharmacy tech to order them. This substitute has been worked on by both the pharmacist and the pediatrician to help get it to a place where it's acceptable by both sides. And the point of this is simply to expand access to vaccines and immunization. It does not take place of a doctor visit, and it certainly does not mandate vaccinations. With that, I believe I have some people here that will be happy to answer any questions, and I respectfully ask for the opportunity to close.
Okay, members, any questions? Okay, we will give you your opportunity to close. Chair calls Michelle Evans, Renan Ching, Dr. Jason Turk, and Amy Lusson. Okay, I have Renan Ching testifying on behalf of Texas Pharmacy Association and Self, and you are for House Bill 3540. Is that correct?
That's correct.
Thank you. You may proceed.
Thank you. Good morning, Chairman Van Dever and members of the House Public Health Committee. My name is Renan Ching, and I'm an independent pharmacist that runs a Tarrytown Pharmacy, a small business pharmacy here in Austin, Texas. I appreciate the opportunity to testify today in support of HB 3540, the compromise offered by Representative Harless. I represent myself and the Texas Pharmacy Association. When COVID-19 shut down brick-and-mortar medical offices in 2020, grocery stores and pharmacies were essential. When vaccinations became available, pharmacists, who have been providing vaccines for 26 years, stood ready to become the first-line providers to people in nursing homes, at mass immunization events, and when more vaccines were available, at our own pharmacies as well. Some of the vaccines were required to be stored in ultra-cold freezer with temperatures between -130 and -76 degrees Fahrenheit, which we had. We were open daily to serve families in our community with our full pharmacy and immunization services. We traveled throughout the state to provide vaccines to intellectually disabled patients and their nursing homes and families, where patients were in rural areas not able to easily go into the pharmacy in person. And even before the pandemic hit, Tarrytown Pharmacy had already been administering immunizations and vaccines to children for many years with a direct prescription from their physician. And this experience really provided us with the confidence and expertise to assist pediatricians and the local health departments to serve families throughout the state. We had many families come in with children, parents, and grandparents to get all their vaccinations as a group as well. So the patients in our community rely on Tarrytown Pharmacy for immunization and vaccines because we're open 7 days a week and open till 8 p.m. on most days. A lot of the families that we serve have parents that work during the day, and they seek services in the evenings and weekends after they get off work. We also work closely with physicians and pediatricians in our area to provide complementary health services to our patients. And pharmacies across the state have similar stories to us and ours as well, and they are the front door to healthcare. We provide convenient access to care as a partner in the healthcare team, and we're committed to improving public health. Under the PrEP Act, pharmacy technicians were also permitted to and trained to administer vaccines, and this bill would provide state authority for PrEP Act immunization authority to continue. So we urge the support of HB3540, the compromise offered by Representative Harless.
Thank you. Chair recognizes Michelle Evans, testifying on behalf of Texans for Vaccine Choice and Self against House Bill 3540. Is that correct?
That is correct.
Thank you. You may
Thank
proceed.
you. Good morning, Chairman Vandever, Vice Chair Campos, and committee members. My name is Michelle Evans. I'm the Political Director for Texans for Vaccine Choice. I'm here on behalf of myself and that organization to testify against HB 3540. To be clear, TFVC does not oppose safe access to vaccines. We support maintaining necessary guardrails, recognizing that the third leading cause of death is medical error, defined as caused by inadequately skilled staff, error in judgment or care, system defect, or preventable adverse effect. The changes in the domain of care for pharmacists and pharmacy techs created under the PrEP Act were done so in response to a recognized public health declaration and were narrowly applied to COVID-19 only. This declaration has since ended, and a subsequent emergency does not exist to justify making these changes permanent nor broaden them. TFVC sought the insight and advice of practicing pharmacists in reviewing this bill, and they expressed deep apprehension. They have very specific limited duties which prevent them from transgressing upon responsibilities typically designated to physicians. Their training and education is specifically crafted for the practice of dispensing, not practicing medicine. Providing vaccines for children as young as 3 or 5 requires specific knowledge in developing organ systems and should involve a familiarity with the patient's unique medical and family history. These are crucial in determining susceptibility to reactions, medical necessity of the vaccination, and whether precautionary measures should be taken before, during, or after the vaccination. Without supplemental formal education and a prerequisite for having a documented, established relationship with the patient, HB 3540 fails to ensure patient safety. An additional concern is that the reporting period during which the pharmacist is expected to notify a physician has been significantly extended now to 3 days from 24 hours, a period during which the patient could experience life-threatening adverse reactions that are not properly diagnosed or treated. In short, it is in the best interest of all patients that any medical procedure they undergo is done so under the supervision of a healthcare provider who has more in-depth knowledge of...
Thank you for your testimony.
Appreciate it.
Chair recognizes Dr. Jason Turk. I have you listed as testifying on behalf of Texas Medical Association, Texas Pediatric Society, and yourself, and you're for House Bill 3541. Is that correct?
That is correct, Chair
Thank you.
Vandever.
You may proceed.
Chair Vandever, Vice Chair Campos, and committee members, I am Dr. Jason Turk, a pediatrician practicing in Keller, and I'm representing the Texas Medical Association and the Texas Pediatric Society. We appreciate the opportunity to testify in support of House Bill 3540. First, our organizations would like to thank Chair Harless for his dedication to child health and willingness to work with us to find common ground on this historically contentious issue. We wholeheartedly agree that ensuring access to timely vaccination is key to preventing the spread of vaccine-preventable illness, such as what we are seeing right now. We also appreciate the attentiveness to promoting the pediatric medical home and ensuring children have access to a full range of preventive health care services present in the well child exam. This compromise legislation strikes a fine balance between those two priorities, which has brought TMA and TPS to support this bill. By bringing the age of vaccination of pharmacists down to the age of 5, we allow families to benefit from some convenience and access while they benefited from during the public health emergency, while still ensuring that our youngest patients are coming into the medical home for vaccinations, developmental screenings, anticipatory guidance, and many more preventive health care services that I provide every day in my clinic. Additionally, this legislation will ensure that when a child receives a vaccination at a pharmacy, that the medical home is notified within 3 days, so that we can ensure that ongoing collaboration and coordination between healthcare settings occur. Finally, we want to thank all the stakeholders involved for their intention to look at ways to bolster participation in the Vaccines for Children program so that all children can benefit from increased access to vaccination. And we sincerely hope that further negotiations on this contentious issue are not needed in the foreseeable future. We thank Chair Harless for his efforts, and thank you to the committee members for your time.
Thank you for your testimony. Chair recognizes Amy Lusson. Have you registered as testifying on behalf of Texas Federation of Drugstores and Walgreens and yourself, and you are for House Bill 3540, is that correct?
That's correct.
Thank you. You may proceed.
Good morning, Chairman Van Dever and members. Thank you for the opportunity to speak today. My name is Amy Lesson, and I'm a licensed pharmacist in Texas and Director of Pharmacy and Retail Operations for Walgreens. I'm also currently the President of the Texas Federation of Drugstores. I want to sincerely thank Representative Harless for the thoughtful dialogue of bringing pharmacists and physicians together to find a true compromise, and one that puts the health of our youngest Texans first. Together, we have created a path that expands access to life-saving vaccines while honoring the critical role of the pediatrician and the importance of the well-child visits. This balanced solution strengthens the circle of care around every child in Texas, ensuring no family must choose between access and comprehensive care. Pharmacists are the most accessible healthcare professionals, and throughout the last 25 years have been vaccinating in Texas. We've demonstrated our ability to safely and effectively vaccinate millions of Texans, including children, without compromising patient safety. Expanding our authority under state law is not about replacing physicians. It's about closing gaps in care and increasing access to critical vaccines, and working as part of a broader healthcare team to protect the public health. As pharmacists, we agree with our physician colleagues on the importance of well-checked visits and reinforce this with parents and patients. We are trained, qualified, and ready. This bill builds on lessons learned in the pandemic, aligns with national best practices, and ensures more Texans, especially children in rural and underserved areas, can stay up to date on life-saving vaccines. In closing, expanding pharmacist and pharmacy technician vaccination authority is a patient-centered, evidence-based step forward in Texas. It builds on proven successes during the pandemic, strengthens our immunization infrastructure across the state, and ensures timely access to critical vaccines, especially for children and families who need them the most. We have seen a significant increase in
Thank you.
families.
Thank you for your testimony. Members, any questions? Representative Pearson.
Thank you, Chairman. Good morning. Thank you all for your testimony. I understand this is a compromise bill, but I still would like a little bit of clarity on what you're asking us to do. When we're talking about children ages 3 to 5, we don't really know what they're allergic to. So my question, I will start with Mr. Ching. You said you had an independent pharmacy?
Yeah, that's right.
Is your independent pharmacy equipped to handle a medical emergency in case one of these children goes into anaphylactic shock?
We are, yeah. So we have, we're a pharmacy, so we have access to EpiPens. We have a protocol right now that was written by a physician that gives us guidance on what to do. We're also pretty close to several hospitals, and so we already have been trained, especially when we go through our immunization training. We also go through CPR training as well. And the number one thing you always do is activate the emergency response system. I just did my training on Friday, so I'm ready. But the big thing too is we have to partner with folks too. So if there's something that we're not prepared for, we already have all of the things at our disposal. We are a pharmacy. We have access to those things that can reverse an anaphylaxis reaction. Also, we have access to medical care with the hospital, but also we are trained and we do our recertifications every 2 years for CPR, and we also have plenty of training with vaccines and also know the main side effects and a lot of the contraindications to vaccines. So as we are going through and helping people get vaccines, we're also screening for those things that would make it that this patient shouldn't get one, and those are all provided by the CDC. So I feel pretty confident in the fact that we can take care of these patients and then partner with our colleagues in the healthcare community to make sure that we take care of everybody if needed.
So is it your testimony that your pharmacy is as safe as a doctor's office?
I would say that we are safe. Physicians provide different levels of care that they are specifically trained on, but I would say getting a vaccine in a pharmacy is safe, yes.
But as safe as a doctor's office, or no?
Sure, yes, as safe. Yeah.
That's your testimony?
That's correct.
Okay, thank you. For Dr. Turk, is that correct?
Yes, ma'am.
Let's see. The focus of a pharmacist education versus a physician is quite different. Would you agree?
I can testify to what my focus is, but I can't testify as to what the focus of a pharmacist's education is. I'm not a pharmacist.
I think that's a great answer, but what I'm trying to get at is pharmacists are focused on laboratory, formularies, medications, not necessarily whole system treating. So my question for you is, do pharmacists have access to the entire patient's history, as you would?
I think that they have access to the necessary information that are required to provide the service that are being asked of them.
Okay, I'll ask you again.
Sure, yeah.
Do you have access to the full patient's history?
So what we do, again, is we do an intake form, so we are able to collect that information. So like I said, for my kids, for instance, like at the physician office, they ask a lot of questions. And like I said, I'm not a physician. I'm not trained to be a physician, so I can't speak just like, a physician can't speak on the pharmacist training. However, as we go through, there are specific things that we need to collect and gather in order to provide these safe immunizations. And I do feel that in the course of us getting someone an immunization, we do collect the necessary information to be able to identify if this is something that's going to be appropriate for a patient. But that's why the collaboration between physician and pharmacist is so important, because we are sharing that information with them, and that's why we have the registry as well. So by us being able to provide this access, help get people to a medical home. Again, most kids in Texas don't have a medical home, so they don't have a physician they're going to. So for us to be that first line of defense, to be able to meet with these kids, help direct them to a pediatrician, I think we can collect the necessary information, we can do it in a safe way, and hand that off so that the pediatricians can then take the ball from there. But I do think we provide adequate care in the form of immunizations with the information provided to do that in a safe manner. And again, we partner with our physicians and our pediatricians, and together we have an entire profile. So I would say that, across medicine, the whole goal is to collaborate to create the best picture of a patient, and that's why we need to collaborate and work together like this bill is doing.
Is the pharmacist education focused on formulating a treatment plan to address a specific diagnosis?
So we are not diagnosing, and when you provide an immunization, we are not diagnosing either. So when someone comes to us for immunization, I'm not diagnosing anything, but what we're doing is we're following CDC guidelines, just as the pediatricians and the physicians are as well, but we are trained on administering vaccines. So we go through an entire course throughout the semester for immunizations, what the vaccines are, what are the protocols, how do we administer, what's the technique, what are the adverse reactions, how do we handle anaphylaxis, and we're all very well trained. So, and that was my training, 10 years ago, but we've been providing, vaccines for over 26 years. And again, before any pharmacist or technician can go and administer vaccines, we have to go through this training course. And so we have to go through not just a didactic course where we learn all of this, we have to actually go through a demonstration. So we have to show correct immunization technique. We have to show that we know how to handle adverse reactions. We have to show that we know what to do when there's an anaphylactic reaction. So I feel very confident that pharmacists are trained in this way. But yes, we are trained through not only medications, but in order for us to learn medications, we also learn about all the systems as well. So I feel like a pharmacist training is very well equipped to provide immunizations.
Yes.
So in response to your question about the pharmacy access to the complete medical record of the patient that they're attending to, there are plenty of examples of immunizations being given across the state in other settings in which that's not going to occur. For example, school vaccine clinics or flu clinics or things like that. So I think that what the gentleman is stating, they have protocols, they have education, they have training, I think more than adequately addresses the concerns about the necessary skills to provide the service.
Well, my questions are coming from parents who are concerned when they take their child, 3-year-old, 5-year-old, to the doctor. There's a full patient exam, which a doctor would be able to recognize or diagnose another issue prior to administering a vaccine. So these are where the questions are coming from, so I appreciate you answering them. So I guess I'm just trying to figure out why we would want to eliminate the physician from examining the child to identify if there are any issues where the vaccine should not be administered at that time. Yes.
And I think that's the point of this bill, is that we're not eliminating, we're really partnering. And so again, the majority of kids here in Texas don't have a medical home. There's people that, again, like my pharmacy, we went across the state to Eagle Pass, Texas, to Laredo, along the border, to all these small towns, like all across Texas, providing immunizations to intellectually disabled patients. Those are patients that were wardens of the state. Those are people that have family members that don't have access to health care. And those were people that we needed to make sure that had access. And if they didn't have access to a physician or if they didn't have a medical home, again, a pharmacy, you can walk into any chain pharmacy, independent pharmacy, and ask to speak with a pharmacist, and you're speaking with a trained medical provider within seconds, you know? And so I think we are the most accessible healthcare provider, and our job is to make sure that we can help navigate and triage people through this really confusing healthcare system. And that's why I think it's so important to partner with physicians, because if someone comes in and we're giving them a flu shot, let's tell them how important it is to go see their get their well visit from their physician. Let's tell them how important it is to make sure that they are seeing their provider regularly, because sometimes if someone's coming in and they're not already seeing a physician, but they need a vaccine for school, or they heard on the news that there's an outbreak going on in their school, or if the flu's really bad, how great of an opportunity that is for pharmacists to be able to provide that opportunity to help be a resource and education for these patients. Because again, the healthcare system is so confusing, but I feel like as a pharmacist, it's our job to help demystify that and also help attach and connect people with care.
Thank you.
You're welcome.
Members, other questions? Representative Schaffner.
Good morning. Thank you, Chair. What are, Mr. Chen, what are the duties of a pharmacy tech?
Yeah, so pharmacy technicians, they do a lot in the pharmacy. So basically, they're able to do data entry. So they type the prescriptions from the physician for us to review as pharmacists for the final review. They will help put tablets or capsules into a bottle. They'll help label. They'll help answer our phone calls, help triage people to see if they need help with a refill. But also, more importantly, in the last 5 years with this, they've been able to administer vaccines as well. Again, they have to go through the same training that our pharmacists do as well. They have to go through an approved course by the American Pharmacists Association that goes and guidelines how to do the administration, how to do the look for different side effects. Again, all of this is still with a pharmacist being present as well. But our pharmacy technicians are so vital to the lifeblood of a pharmacy, just as a medical assistant and nurses are to a physician's practice as well.
So what would this look like practically? A mom and a child come in, and then what? Say, we need a vaccine?
Yeah, sure. So I can break down. So at my pharmacy here, so we have a lot of folks that will come up. A lot of people may not know what they need, or may just say, hey, I heard that there might be a vaccine. We do a lot of education. So in the pharmacy, whenever there was, when the measles first were reported, a lot of older folks were saying, hey, I was born in the 50s or the 60s. Am I covered? So a lot of what we do is we do education, and we help teach people, or help, again, break down those recommendations. And so if you wanted to get a vaccine, we would give you an intake form. We collect your information. This information, just like in a doctor's office or at a hospital, collects your name, your date of birth, what allergies you may have, any past medical history for surgical, all the things that we would need to make sure that this is appropriate. Because all vaccines have things that they warn, and some are just contraindicated, which means that if you have this, you shouldn't get this vaccine. So again, we're trying to identify the things that would preclude or stop someone from getting it. And all of that is going to be documented. It goes to our pharmacist for review. And again, in my store, we have our pharmacist providing immunizations. In a lot of other pharmacies, we have technicians that we've had technicians trained as well. But then after that, the pharmacist will review it, make sure it's appropriate. We'll get everything prepared, and then it will usually be administered to the patient in one of our vaccine rooms.
Okay, so, and you had mentioned several times that there have about adverse effects. So if there's an adverse effect, what would be an adverse effect?
Yeah, to be honest, the most common side effect or adverse effect we talk about is just a sore arm and some fever, just to be honest. Some of the more serious ones that we try to at least educate people about is for certain live vaccines. There aren't really that many, but we provide like yellow fever vaccines, for instance, at my pharmacy. So again, because that's a live vaccine, which again, most vaccines are not live, but in the case of yellow fever, if you're going to Uganda or a place where there's a higher risk and things like that too, you would just make sure you look out again for a potential higher reaction of, again, fever. Sometimes people might feel like they're just kind of sick with the flu. But again, as far as it goes, the majority of the vaccines, the biggest side effect is a sore arm and potentially some swelling in the area, which we usually kind of help the patients kind of navigate if they have those issues. Again, we're so accessible, so we tell people to call us if they need. Sometimes they already are going to see their physician, or maybe their physician actually recommended they come to the pharmacy, because again, we work with a lot of physicians that maybe don't want to stock the vaccine, or sometimes we provide vaccines to physicians or pediatricians as well. So we really do partner well with physicians and try to, again, help the patient as best we can from a holistic approach.
So with the serious adverse effects, who will be liable for those effects? Would that be the pharmacist, the tech, the
Yeah, I mean,
pharmaceutical company? Who would be
yeah,
liable?
that's a good question. I don't know off the top of my head. I would have to like dig through the law and everything too, but I'm not sure. So I'll get back to you on that.
Okay. Ms. Evans, do you have anything to comment on as far as the adverse effects?
Well, I mean, adverse effects documented in vaccine court, for instance, are up to and including death. So you have some life-changing, debilitating injuries and, fainting on site. There's a long documented history of side effects from vaccines, not all of which are included in the CDC contraindications. But to answer your last question, nobody is liable. No one.
No one is liable. Okay. So who, in your opinion, should be liable?
Depending on the circumstances, at the very minimum, the pharmaceutical company should be liable for any harm or injury, just like they're liable for other products that they create. But if there is some sort of medical error, then whoever is administering the vaccine.
Yes, sir.
We have had in this country a program that provides compensation for individuals who are injured by vaccines. It's called the Vaccine Injury Compensation Program. And it is federally, it's a federal law that went into effect several decades ago, and it takes vaccine injuries out of the tort system and provides a completely different pathway for providing compensation for the rare instances in which people are injured by vaccines.
Does that mean that federal dollars are paying these funds and supplying this money, and not the pharmaceutical companies?
So there's a 75-cent fee charged for each antigen within a vaccine. So the MMR would be $2.25. That money then goes into the general revenue fund in the federal government. So you are, as a private citizen, if you go into the vaccine court program or vaccine injury compensation program, you hire an attorney. That attorney is then fighting against Department of Health and Human Services, who is represented by the Department of Justice and an administrative court.
Great, thank you so much.
Representative Alcott.
Thank you, Mr. Chairman. So it's my understanding that this PrEP Act actually allowed pharmacists to start dispensing, it kind of loosened the rules how they could begin dispensing vaccines in response to the COVID outbreak. Is that correct? So what this bill does is correct. It actually expands the authority to include the administration of all FDA and ACIP approved vaccines, not just COVID vaccines, but and for kids up 3 years and up. Is that correct?
So the bill, as presented, will do flu and COVID 3 and up, which is currently consistent with what the PrEP Act is. And currently, the Texas state law is 14 and up, and that 14 will come down to 5. So really, it's going to be maintaining the flu and COVID 3 and up like we've had with the PrEP Act. And then currently, it's 14 and up, and then that'll come down to 5 for all the other vaccines.
Okay. Well, it's obviously everyone in here understands the reason for doing that during the COVID, but now that's passed away. Why do you think this is so necessary? I mean, and you don't. It just seems to me that let's say a parent comes in and wanting to bring in their child in and have a vaccine, but they have questions about some stuff they read about or adverse reactions. Do you believe? I mean, it sounds like you're pretty educated on these issues, but do you really have confidence that a lot of pharmacists around the state are educated enough to answer those questions to a parent that has read about the potential hazardous and side effects of vaccines?
I do. Yeah, like I said, as a pharmacist, we know our training. We've all been, like I said, it's been very staple of our curriculum to go through vaccines and make sure that we understand this well. So I think as a part of going through the pharmacist curriculum in pharmacy school, I feel like pharmacists are well trained to do this. And again, vaccines access is so important. And again, I think even though the pandemic, was the reason that this kind of started, I think we can all kind of agree that providing access and making sure that we can continue to partner with other healthcare providers to, again, have access to vaccines for those that want it, I think is going to be ultimately a good thing for those folks that decide to get it. And then Amy.
If I could just add as well, if a parent comes in and they have a lot of questions about a vaccine or they read certain things, and the pharmacist goes through it with the parent, they'll also refer them to their physician. If it's questions that the pharmacist is not able to answer, or they feel like this conversation you need to also have with your physician, we will refer to the physician very regularly.
Yeah, I just have serious concerns that physicians are being, I know you're saying you're trying to have working relationships with physicians, but I think in all practicality that doesn't, it's not as easy as you say. And I'm just wondering, Dr. Turk, I'm just surprised that the TMA isn't more concerned that you're letting the pharmacists be involved in making some of these decisions, because once these kids take the vaccine, then it's really too late for the physicians to intervene. Do you have any comment on that?
So we would prefer that all of our patients come to us for all the services that are necessary in the medical home. We recognize in certain circumstances, such as annual influenza vaccination, that it's virtually and practically impossible for the entire population to get vaccinated every year for influenza. We don't have the capacity in the medical home to do that for the entire population. And so for many, many years, we have supported as many access points to influenza vaccination as possible. And so that's the rationale. We are in the midst of a measles outbreak right now. And that should be on the top of everybody's mind with respect to access to important vaccines. We want to make sure that we are striking an appropriate balance between practicality and convenience and prioritizing the medical home. We're not dogmatic about that. We have to be practical. And we have to understand that the compromises may need to be made when the needs be. We do actually collaborate quite well with pharmacies, and I regularly talk to pharmacists when I have a question about a particular medication, or if they have a question about a medication I prescribed, or there needs to be some clarification. So that relationship does exist.
So how would that practically work? So if you've got a parent inside of a Walgreens wanting to get a vaccination but has some questions and the pharmacist doesn't know how to answer them, how easy would it be to actually call up a physician and get that answer when the physicians are in the middle of seeing patients?
So I think it's going to vary from situation to situation, but as the other witness testified, if there's a question that is more than a straightforward what happens with this particular vaccine, what adverse reactions can we expect, if there's a deeper question, then I think it's reasonable for the pharmacy to say, you know what, I think that you have more questions than what we can answer right here. Why don't you follow up with the physician about this? And they'll come to see us and we'll talk about it. And if it's appropriate to give the vaccination at that time, almost certainly we'll provide it in the medical home.
Okay, thank you.
Okay. Representative Pearson.
Thank you, Chairman. Doctor, you'd mentioned the vaccine program for injuries, the compensation program. What is someone to do if a pharmaceutical company is immune from the program, which we saw with COVID? These pharmaceutical companies were giving immunity. So what is a family to do if these pharmaceutical companies are given immunity? I'm trying to figure out what recourse these parents would have.
I guess I don't understand the question. What are they to do in what circumstance?
Yeah, we're talking about liability. You mentioned the vaccine injury program where you could somehow seek liability. But what if there's immunity there? That means that someone can't seek liability and these families are just stuck with all the damage that has been caused by some of these vaccines.
What damage are you speaking of?
Well, I mean, look at myocarditis, which is one of the things that came out of COVID. And there is a statute of limitations to make these claims as well. So I was just curious, back to the liability question. I mean, this discussion reminded me that COVID, for example, was one of the vaccines that was the pharmaceutical companies were given immunity.
Sure. If we could just I'll be happy to walk through that particular situation with you since you brought up myocarditis. So myocarditis is a recognized potential complication arising from some COVID vaccines in certain populations, but it is a very rare event. And the risk of myocarditis actually is much, much higher with COVID-19 disease than it is with the vaccine. However, if somebody gets myocarditis in the context of a COVID-19 vaccination, which we're not really focused on COVID-19 here, but if they happen to have that condition, it typically arises within the first few days following the event, following the immunization. And if they have a complication such as that and they wish to seek compensation, then they access the Vaccine Injury Compensation Program, and there are well-described processes for doing that. The program is intended to indemnify pharmaceutical companies from liability so they can actually produce vaccines without fear of multi-million-dollar judgments against them. If that was there, then they would not come out with vaccines to protect the population. So what are they to do? Well, they have a program in which they can be compensated for injuries that if they have injuries from vaccines, and that program makes them whole financially if that's what they are seeking.
So you're saying that the government did not waive liability for those specific vaccines? And I use the vaccine because that's really the elephant in the room when it comes to vaccines, particularly after the pandemic. So
I'm sorry, what is the elephant?
the COVID vaccine, you said we're not focused on it, but we really are, because that is one of the vaccines that has caused a lot of confusion all across the country. And parents are concerned that we're going to skip the doctor now when administering these vaccines with a bill like this. So I'm just trying to find ways to reassure families, since this is a agreed upon bill, that these issues aren't going to be a problem, particularly when pharmaceutical companies were exempt from liability. So again, it's back to the liability. I think Representative Schaffner asked the question, so it would be helpful for families to know if they're going to have recourse. With tort reform, it's really hard to get a lawyer if your child has been injured. So we're trying to figure out how to give families comfort in moving forward with this.
I think that the foundation of your question is that the families don't have recourse, and they do have recourse if they've sustained injury from vaccines, whether it's an individual or a child. And that recourse is to the Vaccine Injury Compensation Program.
Okay. Ms. Evans, do you have anything to add to that?
Well, as far as recording, there are caps there, so making somebody whole when their child has died, that's pretty difficult when there is an economic cap. Second of all, in order to find an attorney that will take a case to the Vaccine Injury Compensation Program, there are very few attorneys nationwide who are trained in that program and are willing to take on those cases. So I think he's oversimplifying it. I think there's also a concern that came up just now, that this pharmacist who is well-trained in immunization practices did not know about this Vaccine Injury Compensation Program, so is not able to communicate that to patients. I haven't heard anybody talk about the Vaccine Adverse Events Reporting System, whether or not we should be requiring anybody who vaccinates a child to be trained on that, to be trained on reporting, to know what it is. And in Texas law, there are a variety of people who are authorized to take a child to get an immunization, not necessarily just their parent or guardian. So whether or not that person is going to know that child's family history when they're filling out a simple intake form, there's just a wealth of concerns that we have about the safe access and follow-up and the training necessary to vaccinate a child safely.
Thank you.
Thank you.
Representative Johnson.
I didn't want to get too far off track on this, but in the beginning of COVID-19, New York experienced more death because of the concentration of population and the lack of vaccination, and Texas was relatively low for either one of the pharmacists that can answer that. Is that right? You are aware that that's right?
Yes.
And then even after vaccinations came out and we had vaccinations, that is when Texas saw its height of death from COVID-19 because of vaccine hesitancy. And Texas significantly surpassed the rest of the nation in preventable deaths. Is that right?
That is my understanding, yes.
And the concern would be vaccine misinformation, just like we're seeing in MMR right now, where we've had 2 children die because of a refusal to have their freedom-loving parents provide them vaccination,
Incorrect.
as opposed to when we had almost made measles no longer an issue or death rate for children.
I think that there is a tendency to overestimate and overemphasize risk from acts of commission in giving a vaccine versus acts of omission, which is not giving a vaccine and accepting the risk that is already there, which is from the diseases that we're trying to protect people from. I've been a pediatrician for over 25 years, and I've given tens of thousands of vaccines over the course of my career. I have never had a serious adverse event occur in any of my patients. It does happen, but these are infinitesimally small frequencies. And we always are much more worried about, what if I do something that's going to hurt somebody? Well, the fact of the matter is, and we're seeing this with measles, the successful leveraging of people's concerns about risk from vaccines has resulted in a withering of our vaccine coverage rates, which is why we're now seeing the outbreaks that we're seeing right now.
And again, we're not a nation that mandates vaccinations. It's completely by choice, but that choice has to be with some scientific backing and legitimate public dialogue around public health and risk. So I appreciate you all being here on all sides to have the dialogue. It's an important dialogue.
And may I address something? So the children who died, they are from a very religious community. It's not freedom-loving parents. I think that and I think
They're
the
Mennonites,
Department
right?
of, correct.
And the
Department
issue
of
is-
State Health Services Executive Commissioner came here in our first Public Health Committee hearing, and she talked about how they are in that community now. There have been a lot of parents there that have accepted the public health agencies coming into their community. That's just a deeply held religious belief. It's not, I think it's a misnomer to say that they're just these freedom-loving parents that want their choice. They're deeply religious.
Are all of them deeply religious?
In the Mennonite community,
I'm not asking about the Mennonites. The problem is what we've seen over the last decade is that we're seeing counties get to that tipping point of almost 5% unvaccinated. And what that means is there is no freedom or choice for other parents who have immunocompromised children who can no longer go to the grocery store or put them in school because other people are choosing something that at the moment seems to be a politically motivated debate. So I'm all for religious freedom, but I think it's hard for us to suggest that the increase in what we've seen around this is not based on religion, it's based on politics, and that's what worries me. This is a public health discussion.
and that's a valid perspective to have. I was speaking specifically to the cases that you were referring to.
And those children died.
Correct.
Thank you.
Representative Schaffner.
Thank you. Dr. Turk, are you, as a pediatrician, for the infinitesimal amount of adverse effects that you've seen, are you required to report those adverse effects?
If there is a serious adverse event arising from of an immunization that I provided, then yes, I make a report to the Vaccine Adverse Events Reporting System.
And what is defined as serious?
Anything.
Is that your judgment, or is there some sort of protocol?
Well, there are going to be adverse effects that are common and which are not reportable, such as injection site swelling, a rash, soreness at the injection site, low-grade fever, anything that is. There are standard definitions of serious adverse events, and if it is a serious adverse event as opposed to a common expected side effect from a vaccine that is self-limiting and not significant, then it's something that we do make a report on. Yes.
Thank you.
Okay. All right, thank you for your testimony. Is there anyone else who wishes to testify on, for, or against House Bill 3540? Not. Chair recognizes Representative Harless to close. While he's coming up, I want to remind everyone we do have an overflow room, room E2036. And I know the sergeants are going to try to keep the doors clear, so if you can assist them in that, it would be greatly appreciated. Chair recognizes Representative Harless.
Thank you, Mr. Chairman and members. This bill is only about access. It doesn't mandate anything. In a perfect world, all of our children would have a pediatrician or a family doctor to go to, but they don't. And with that, I want to thank TMA, the Pediatric Association, and the pharmacies for coming together and getting agreed-upon language, and I close.
Okay, I think we have a question, Representative Jones.
Yes, ma'am.
I actually don't have a question, I have a comment.
Yes, ma'am.
I'd like to thank you with all the discussion in this committee about doctors and pharmacists, the fact that you were able to get TMA and the pharmacists on the same page. Hallelujah, thank you, Jesus.
And the pediatricians.
I'm glad I got some levity out of this. So you are doing God's work.
Thank you. I appreciate that.
Thank you. Okay, Chair withdraws committee substitute. If there's no objection, House Bill 3540 will be left pending. Is there objection? Chair hears none. House Bill 3540 is left pending.